Hello, I'm Ohio Governor Mike DeWine. Welcome and thank you for joining us today for this important webinar. Ohio is on the road back. Thanks to vaccines and thanks to your efforts, we're getting back to the things we loved doing before the pandemic. Together from the very beginning, we have been committed and consistent about prioritizing older Ohioans in our fight against COVID-19. That has been apparent through your hard work in facilities and also throughout the state of Ohio. The vast COVID-19 testing program for long-term care facilities has helped us identify and prevent additional spread of the virus in our nursing homes. Ohio worked to get PPE to care facilities even when the nation faced great shortages. We also made nursing home and assisted living residents among the first in the state eligible for the vaccine. As vaccines became more widely available, we ensured that all older Ohioans had access in what we then called Phase 1B. Efforts continued through programs such as the senior housing vaccine clinics and homebound efforts. Ohio also moved quickly and was the first state in the country to put in place a vaccine maintenance program for our nursing homes and assisted living facilities to ensure that every single staff member and resident had an opportunity, a continuous opportunity, to get vaccinated. Throughout the last year, we have worked diligently to ensure health orders struck the important balance between protecting physical well-being and mental well-being. That balance has been center stage for many of the discussions and decisions made with medical experts. As the community spread finally started slowing down thanks to the wide availability of vaccines in Ohio, we updated those orders once again. Now is the time when we transition from orders to guidance. The orders outline what should be done, but now you know how to protect older Ohioans and how to incorporate those best practices into the daily operations of your facility. Ohio continues to make tremendous progress on our road back, but you must continue to be vigilant. Now, we are still seeing some outbreaks. They're certainly fewer than they were before, but they are occurring. And as our nursing homes, assisted living open up with increased interaction, and comes increased risk of additional infection. So please continue the safe and healthy protocols. Mask up in healthcare settings, mask up elsewhere. If you're unvaccinated, get vaccinated. Continue good cleaning practices and reduce the chances of illness by holding activities and visits outside whenever possible. We're trusting you to continue the important work of protecting those who have been most impacted by this virus. We're looking to you, the leaders of our nursing homes, our assisted living facilities, our adult care services, and senior centers, to help lead the way into the next phase of the pandemic. I know that the last 16 months has been very tough, and very tough for you. It's been a strain on resources and a strain on you emotionally. Thank you for your dedication. Thank you for your compassion. Thank you for making Ohio the best place to age in the nation. We are a better, stronger, healthier Ohio because of you.
Thank you, Governor DeWine, and thank you all for joining us today. My name is Ursel McElroy, and I am the Director of the Ohio Department of Aging. It has now been a year since the beginning of what is arguably the largest public health emergency most of us will experience in a lifetime. COVID-19 took aim at older adults, threatening their health, their needed services, their interactions with loved ones, and their lives. And throughout, you have been called upon to be brave, flexible, and resilient, among other things, and I thank you. And while we are still in the midst of the pandemic, I am encouraged that we have opportunities like today to begin restoring the critical connections we all very much need. During this hour, lines will be muted, but feel free to use the question function. We will make every effort to post helpful information, tools, and resources to address any questions you might have today. Ohio is on average at less than 50 cases per 100,000 people. And effective June 2nd, Governor DeWine lifted the vast majority of public health orders. Group dining, communal spaces, and shared transportation may increase the risk of COVID-19 spread, especially for unvaccinated participants. Administrators and staff can help protect themselves and program participants from COVID-19 by promoting and engaging in preventative behaviors that reduce spread and maintain healthy operations and environments at centers. The Ohio Department of Aging's Ashley Davis, Chief of the Elder Connections Division, joins us now to cover some resources to empower centers to make the best decisions as they increase capacity and resume full services.
Thank you, Director McElroy. As we know, this situation is evolving, and we need to be proactive in our response efforts. To help stay informed, ODA has developed a new landing page to address where we currently are in the pandemic and provide specific information for COVID-19 resources for congregate living, including nursing homes, assisted living, adult day services, and senior center settings. We encourage you to visit the website as it will continually be updated with resources relative to different congregate settings. The Adult Day section includes information on vaccine support, testing, frequently asked questions, poster and signage request, and a congregate toolkit coming soon to support enhanced opening. ODA has also developed the Staying Connected booklet. Your organizations are uniquely positioned to support the needs of older adults during the pandemic, importantly addressing and enhancing social inclusion and connections. And you have continued to support those needs over the past year. The Staying Connected booklet includes important information such as screening for isolation, strategies to combat isolation, and other resources. To request booklets to distribute to older adults and caregivers you serve, visit our webpage on the slide to request these resources. While we continue to encourage you to visit our website, we also encourage you to visit the CDC website. They have two specific resources for Adult Day Center administrators and participants. Administrators, staff, and volunteers at Adult Day may use the guidance to plan for and implement prevention strategies to prevent COVID-19 spread at your facilities. We encourage you to frequently visit CDC's website as CDC will continue to evaluate and update public health recommendations for fully vaccinated people as more information including new variants, becomes available. Please note that this guidance may be used to support your operational decision-making. You know your spaces and need to be aware of the risk that organizations may be bringing by bringing together both vaccinated and unvaccinated individuals, including the highest risk group with susceptibility to COVID-19. We expect organizations to stay aware and tuned into their local vaccination rates, as they differ greatly across the state. We also know that vaccines are safe and effective and provide opportunities for expanding activities. The third resource listed on the slide includes specific information on activities relative to risk based on vaccination status, as well as prevention, such as masking and distancing, to take based on activity. Fully vaccinated people can resume activities. They may refrain from testing following a known exposure if asymptomatic, refraining from quarantine following a known exposure if asymptomatic. But for now, fully vaccinated people should still continue to get tested if they are experiencing COVID-19 symptoms and follow CDC and health department requirements and recommendations. There continue to be important infection prevention and control recommendations to prevent and reduce the spread of COVID-19. And as a gathering place where unvaccinated and vaccinated individuals may be present, we need to continue to take smart, common sense prevention and control measures. These are the same infection prevention and control recommendations that have been proven to be successful in mitigating COVID-19. The first practice is around vaccination. Adult day centers are uniquely positioned to support vaccination for staff, participants, and volunteers. Providing education and dissemination of credible information about COVID-19 vaccines can support safe services at your center. Promote local opportunities for vaccination clinics or look into hosting a vaccination clinic at your site. Infection prevention and control includes staying home when appropriate. This includes educating staff and participants about when they should stay home and when they can safely return to the adult day center. Staff and participants should stay home and follow CDC recommendations if they have tested positive or have symptoms of COVID-19. Staff and participants who have recently had close contact with a person with COVID-19 should also stay home, monitor their health, and get tested. If staff and participants are unsure whether they should stay home, they or their caregiver can use a COVID-19 self-checker, such as the one on CDC's website, to help them decide. Staff and participants should not enter an adult day if they have COVID-19 symptoms, are undergoing evaluation for COVID-19, such as a pending viral test, have been diagnosed with COVID-19, or have had close contact in the past 14 days. Provide education on COVID-19 related symptoms and reminders to notify center staff if everyone is feeling symptoms of COVID-19. This is critical to provide timely assistance. Unvaccinated staff and participants should wear a mask when in the presence of others. Masks protect the wearer as well as those around them. Masks should cover your nose and mouth, fit snugly, and have multiple layers. Wash your hands often and ensure participants can wash their hands appropriately. Staff and participants should wash hands often with soap and water for at least 20 seconds, especially after you have been in a public place or a common area, or after blowing your nose, coughing, or sneezing. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Cover all your surfaces of your hands and rub them together until they feel dry. Staff members should assist people with sensory, cognitive, or behavioral issues and people with a disability or dementia who may have challenges washing their hands properly and as frequently as recommended. On to ventilation. Make sure indoor spaces are well ventilated. For example, open windows or doors when doing so does not pose a safety or health risk to building occupants, and large enough to accommodate distancing. Ensure ventilation systems operate properly and increase circulation of outdoor air as much as possible, both in the facility as well as in any vehicles used by the adult day. Consider improving the engineering controls using the building ventilation system. Reinforce prevention strategies using signs and messages throughout the facility. Display visual posters with instructions for maintaining distance, wearing masks, taking temperatures, and monitoring for symptoms. Use tape markings on the floor to help people maintain distancing and directional arrows to establish the flow of traffic. Designate different doors for entering and exiting if possible. Post signage in highly visible locations, such as at building entrances and in restrooms, that promote everyday protective measures and describe how to stop the spread of germs by properly washing your hands and wearing masks. Use reminders for staff and participants to monitor COVID-19 symptoms. Include messages about behaviors that prevent spread of COVID-19 when communicating with staff, participants, and others who may be in your center. Health screening. Make employee health screenings as private as possible to prevent stigma and discrimination in the workplace. If screening in person, participants, screening staff, and employees should be screened, should wear masks and maintain distancing. Consider virtual health checks for employees and participations as you've done over the pandemic before they arrive in the center. Remember that symptom and temperature screening cannot identify people who are asymptomatic or are pre-symptomatic. Therefore, wearing masks, hand hygiene, cleaning, and other prevention strategies still should be used to reduce transmission. Additional recommendations on infection prevention control. Plan to have an isolation room, preferably with access dedicated, that you can use to isolate sick participants or staff members. And ensure that isolated participants are wearing masks and are at a distance. In accordance with state and local laws and regulations, adult days shall notify local health officials, staff, participants, and caregivers in cases of COVID-19 in their facility while maintaining confidentiality in accordance with the ADA Act. Inform those who have had close contact with a person diagnosed with COVID-19 to stay home and self-monitor for symptoms. And arrange tables and chairs to allow for distancing. People from the same household or cohorts can be in the same group together, but space seating at least 6 feet apart. Continue to alter schedules such as staggering meal and activity times and creating pods or cohorts that do not mix with other individuals from groups. COVID-19 vaccines are effective at protecting you from getting sick. Based on what we know about COVID-19 vaccines, people who have been fully vaccinated can start to do some things that have stopped doing because of the pandemic. As of June 16th, 80.3% of individuals over the age of 65 have received at least one dose of the vaccine, equating to over 1.6 million people. The Regional Rapid Response Assistance Program builds on previous support by committing teams of regional experts to help identify and diagnose issues with care delivery and provide support to resolve them. Assistance provided by the RAP teams include, but is not limited to, vaccination, testing and cohorting, temporary staff support, and infection prevention and control education. If your center is in need of hosting a vaccination clinic at your adult day location for staff and community members, please reach out by June 30th, 2021. Center administrators should call 1-855-R3AP-ODA or 1-855-732-7632. ODA was able to provide 2 rounds of provider relief for adult day and senior center providers. Ohio 1 was offered at the end of 2020 and the most recent this spring 2021. The Office of Budget and Management, in partnership with the Ohio Department of Aging, released $4.95 million in additional funding to support adult day and senior centers who serve older Ohioans by offsetting some of the added costs of the COVID-19 pandemic. 39 adult day service providers and 65 senior centers received this funding across the state for the second opportunity. The funds are to support restarting and continuing services through this emergency. This is in addition to the $4.8 million provided in December 2020 for pandemic cost recovery and safe operational expenses. Next, we're going to go over a few common questions about resuming full services at adult day service centers. The first question is, we are preparing to reopen. Can we still receive state support for testing? Yes. At this time, if you choose to continue to test, state-supported testing is being offered at no cost to centers. If centers choose to coordinate their own testing, each center is responsible for all cost of the testing. The second question, if participants and staff are fully vaccinated, is it okay to not wear a mask? Centers are encouraged to follow the mask guidelines set forth in the Centers for Disease Control and Prevention Guidance for Adult Day Service Centers. Next question. Are centers legally permitted to require vaccination of participants or proof of vaccination? Requiring vaccinations is a local business decision. Centers should use their best judgment to keep staff and participants safe. Whether or not a private business is subject to laws or regulation affecting their ability to require proof of vaccination is a center-specific matter. Centers should work with independent legal counsel to develop and implement a center-specific plan for complying with all state and federal laws and regulations. We are committed to supporting safe operations for Ohio's Adult Day services. We know our older adults and caregivers are looking forward to safely returning to centers for services, supports, and activities they enjoy. We are confident you can use the resources presented today to identify the best practices and safe operations for your center.
Thank you so much, Ashley. We understand that each center is unique and operations may differ from one center to the next. However, we encourage you to lean on these resources and feel empowered to make the best decisions for your staff, volunteers, and of course, your participants. Should you feel a need or desire assistance supporting your operation plan, please connect with the Regional Rapid Response Assistance Program team. So it's my pleasure to have with me today Dr. Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. Dr. Vanderhoff, you have been instrumental during this pandemic, coming aboard in the fall and serving as one of Governor DeWine's principal advisors on COVID-19. It has certainly been my pleasure to work alongside you, and I have simply been fascinated by your vast medical expertise and collaborative approach to getting things done. Now, when you arrived, we were bracing for an anticipated spike in COVID-19 cases. The vaccines were not yet available to us, and we entered December with the infections and deaths continuing to climb. Then, mid to late December, the vaccine arrived, and Governor DeWine made the critical decision to prioritize congregate settings, in particular, those settings that serve older Ohioans, such as our nursing homes, assisted living facilities, and soon after, Ohioans aged 65 and older. Most of us understood that if we were to have a chance to reduce the infection rates and deaths, we would have to work tirelessly to vaccinate residents of nursing homes, assisted living, participants of our adult day and senior centers, and older adults in affordable housing communities and other independent residential clusters. Our cases began to plummet, and the desire to relax visitation restrictions mounted. For some, nearly a year had passed without regular personal contact with loved ones. Recognizing the benefits, measures were put in place to balance the two safely, physical health and emotional well-being. Now, while we appreciate that with every visitor and every worker, there is a risk of exposure, particularly from those who are unvaccinated. So while cases and deaths have declined sharply this year, there is still a risk. So please tell us, are we ready to take this risk?
Well, thank you so much, Director McElroy. There's no question that earlier this month, June of 2021, Ohio achieved a benchmark that we have been looking forward to for some months. We are now reporting fewer than 50 COVID cases per 100,000 residents, a place we haven't been since June of 2020. Reaching this benchmark really is a positive sign, a sign that Ohio continues to move forward into a new phase of the pandemic. We're seeing daily cases of COVID-19 fluctuate in the low hundreds, whereas we are seeing cases, nevertheless, that are reported in the thousands each day when we look back to the peak of the pandemic. So it's a big improvement. It's a really welcome improvement. And as you alluded, I think we can largely attribute these improved case rates to our vaccines? Quite simply, the COVID-19 vaccines are working, and they're working very well. And since vaccines became available for older Ohioans and are now widely available statewide, we are thankfully seeing fewer and fewer cases, fewer hospitalizations, fewer deaths, both in our nursing homes and in our other congregate living settings statewide. So one could really ask rightly, well, what about masks and other precautions? Can we be done with those? And my answer to that is that although the data really is promising, as I've described, everything's moving in the right direction. Nevertheless, older Ohioans, particularly those who are unvaccinated, remain very susceptible to severe complications if they become sick with COVID-19. And we know that people who are in congregate living settings, such as our nursing homes and assisted living facilities, and even our older Ohioans who are coming for care during the day in our adult day settings, that's our most vulnerable population in the state. And when we look at the virus, we have to recognize that COVID-19 isn't sitting still. On the heels of the B117 variant that's now dominant in Ohio, we have another highly contagious variant, the so-called Delta variant, which is actually B1617.2, coming into the state. And reports from around the world suggest that this variant is making unvaccinated people sicker faster and is quickly replacing B117 wherever it arrives as the dominant strain. So continuing with COVID-19 precautions, especially in environments like nursing homes, assisted living, and adult day, will add another layer of protection to help keep more Ohioans, especially older Ohioans, healthy. Now, the case rate in the general population, as I've referenced, is decreasing, and we're very thankful that we have reached and stayed below 50 cases per 100,000 residents. But progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, is why we're all feeling safer. It's why we are able to take some very welcome steps back towards the life we know, life without masks. However, we still need to take certain precautions in the settings that I've described. Our case rate in the general population has clearly decreased, and we're very thankful for that. It's decreased and it's staying below 50 cases per 100,000, but progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, that progress, that's what's allowing us to feel safer as we take important steps back toward the life that we have known, life without masks. But we still need to take certain precautions in the settings that I've referenced, in our nursing homes, in our assisted living, and our adult day settings. These are the settings where the population that is at greatest risk from COVID-19 when we look back at the data both in Ohio and across the state are being cared for. And masks have long been used with success now in not only these settings, but in healthcare settings. And during this pandemic, we have seen just how beneficial masks are in slowing the spread of the disease, particularly among the unvaccinated. Just look at flu and colds. How many people do you know who actually had a flu or a cold this past winter? Not only is it a good practice to wear a mask in a healthcare setting, it's also recommended by the CDC. and it's required by many hospitals and healthcare providers. Now, for those who are unvaccinated, I want to remind everyone that the threat of COVID-19 remains very, very real, especially now with the global rise of the so-called Delta variant. And so we really can't let our guard completely down. If you're not vaccinated against COVID-19, please continue to wear a mask in public. And Ohioans that are able to get vaccinated really should. The COVID-19 vaccines are safe and they are effective. They don't contain tracking chips. They don't change your DNA or impact your fertility or magnetize you. What they do is protect you and others from getting COVID-19. Now, staff and residents in our nursing homes, in our assisted living, in our adult day settings who haven't yet been vaccinated really should talk to their doctor to learn more about the COVID-19 vaccines. Congregate living environments are really special environments where we need to care for and do care for some of the people who are most vulnerable to COVID-19. So in these facilities, we need to be especially careful about creating a COVID safe environment. In addition to taking precautions like washing your hands and wearing a mask, you should take extra care to think about how you can help us limit the spread of COVID-19 in the care environment where you work. So, for example, should we be cohorting residents who are ill or test positive for COVID-19? Of course, we should. What else can we be doing in the environment where you work to keep the people you're caring for and working with safe from this virus? A virus which, as we look back over the pandemic, has taken a very severe toll, certainly on the population of Ohio as a whole, but especially on our older citizens. So remember the important role that all of us play in helping to decrease the risk of spread of this virus, a virus which we're beginning to win the battle against, but a virus which is certainly still with us and which we still need to think about as we get up each day to go into our workplaces and care for some of the most vulnerable Ohioans.
So, Dr. Vanderhoff, I do appreciate you walking us through that very important information. And I think what I find most fascinating is the importance of understanding the difference between some of the guidance that has come out for the general population and why we have to be especially vigilant within these congregate settings. Can you speak to that just again for a moment?
Absolutely. So when the CDC came out with its guidance regarding what we can do safely when we are vaccinated, it was really addressing how we live our lives in more public settings. And there's no question that when we are vaccinated, we are very safe in terms of our risk of getting COVID-19 and even of transmitting COVID-19 to other people generally. But we know from our experience throughout this pandemic that certain settings pose a much greater risk for the transmission of SARS-CoV-2, the virus that causes COVID-19, and for the population that either lives in that environment or is served in that environment. And of course, some of the environments where we have to be the most careful are those where we are caring for our older Ohioans, or our older Ohioans are residing, our nursing homes, our assisted living environments, and our adult day settings. Those are settings where the guidance, along with the guidance for healthcare coming from the CDC, continues to point to the importance of COVID safety measures, including masking. The mask remains a very effective measure for us to help decrease the risk of the spread of this virus. So, thankfully, at this stage in the pandemic, we can feel really good about getting vaccinated and the safety that the vaccine provides us. But we have to remember that when we are in these environments where we are caring for vulnerable people, we have to take extra care and be extra careful. So one of the points I think it's important for us to remember is that the COVID-19 pandemic continues to evolve. It continues to change. And so therefore, the guidance, the healthcare guidance that we need to be mindful of will continue to evolve along with it. Our best guide for understanding what we need to do to keep each other safe is the CDC. And so I would encourage you, as this continues to move ahead, to look towards the guidance that the CDC provides regarding the environment in which you work, whether that's a nursing home, an assisted living facility, an adult day setting. The CDC will continue to be our best guide.
So thank you for joining us today, Dr. Vanderhoff. We do appreciate your time and expertise.
Well, thank you very much, Director McElroy. I want to express my sincere appreciation and the Department of Health's appreciation for your leadership, as well as for all the wonderful work that so many Ohioans who are involved in every day in the care of older Ohioans have offered throughout this pandemic. Your hard work has really made a difference, and there's no question in my mind that the efforts of people in our nursing homes, our assisted living, and our adult day settings have made a difference in the health and the lives of Ohioans throughout this pandemic. So I'm very appreciative, as I know all the members of the Department of Health are, for the work of our Department of Aging and people in the elder sector.
Thank you. It's a pleasure to address you, the staff who are committed to the seniors who depend on Ohio's adult day services. As a physician who has cared for patients like those who have benefited from the services you provide, I cannot put into words the appreciation I have for what you do every day. It has been an extraordinary 15 months since the beginning of the pandemic. I have personally experienced the loss of patients I have cared for years. I've seen staff members who have become ill with COVID and reached out to me for advice and medications. I've had my own family members who worried that I might bring the virus home to them. I've worn the masks and face shields and gowns. I've used a ton of hand sanitizer. I've performed nasal swabs on other people and myself for over a year. So now that we're passing into this next phase of the pandemic, I'm excited about the prospects of returning to a life that is similar to what I remember prior to March 10th, 2020. I understand that it can be similar and that it will be similar, but it won't be the same. Yesterday, I went to the grocery store and I could have bought as much toilet paper as I would have wanted to have. And I actually saw Clorox wipes and Purell on the shelves. I can now visit my 85-year-old in-laws because we're all vaccinated. I can go to church. I could go to a concert or a Cleveland Indians game. Over the past year, I've learned so much about appreciating little things in life and the relationships that went away during the height of the pandemic. There are other things that I've learned this past year. I've learned that everybody deserves grace, understanding, and patience. And make no mistake, the pandemic has affected all of us in ways that we may not realize. I've learned that over the course of the day, when I ask people how they're doing, and they kind of pause and look out at the horizon and say, "Oh, I'm fine," that fine actually probably means feelings inside not expressed. We're now entering a new phase of the COVID-19 pandemic. In fact, I have heard some people say that they thought the pandemic was over. There are very few statements that I can say as a physician with certainty, but one of them is that the pandemic is not over. COVID is still in our communities. It is still among us. And until the entire world can have the opportunity to be vaccinated like we have here in Ohio, the pandemic will continue to be a threat. Over the next days and weeks, it will seem like the threat has passed. We are unwinding the requirements and the policies that the adult day services have been living with over the last 12 plus months. We will eventually be told that this is no longer an emergency. Nonetheless, the same virus that has disproportionately taken a toll on you and your peers and the population we care for remains in our communities and among us. We now have at our disposal an abundance of safe and extremely effective vaccines that, if widely accepted globally, would end this pandemic. In the meantime, this virus continues to make millions and billions of little virus babies, and every once in a while, one of those babies is just not quite so perfect, not quite the same as its parent. It's a variant. And eventually, one of these variants will be just different enough that the virus will not be as effective. And we could slip back into the outbreaks like we experienced last fall. We can prevent this from happening through vaccinations and continuing to practice all the tried and true methods of infection prevention like hand washing and hygiene, wearing masks, especially around the most vulnerable population, and including unvaccinated, and cleaning up after ourselves through sanitization of hard surfaces. Each of you will need to will need to decide whether to continue these practices through the remainder of the pandemic, even if the Ohio Department of Health, Governor DeWine, or the Ohio legislature rescinds the mandate to do so. Testing and infection prevention and control needs to be a part of what we continue to do every day for the rest of the pandemic, even if we're not told that we have to. This now becomes our responsibility. It's kind of like the analogy of school. We have made it through the elementary school portion of this pandemic, where everything's been laid out for us and we just need to follow the instructions to color inside the lines. Now we're entering the college phase of the pandemic, where we get to choose what classes we take and what path we follow. The Regional Rapid Response Assistance Program, or RAP program, for which I serve as the Chief Medical Officer, stands ready to support you and your organization over these next important months. The state of Ohio will continue to provide testing supplies like rapid antigen tests and the ability to do PCR testing and vaccinations against COVID-19. If you go back to the metaphor that I talked about us entering the college phase of the pandemic, think of the RAP program as that guidance counselor who is always there to help you get through your schooling. The program is supported through the Department of Aging with money allocated to fight the pandemic. We have 8 regional medical directors, some of whom will be answering some of your questions in just a few minutes. These medical directors can help you and your team when questions arise about testing or the management of outbreaks. We have contracted with an organization of contact experts in infection prevention who is available to you and your organization for COVID prevention and control, testing strategies, and to provide another voice to educate about the value and importance of vaccination acceptance. In medicine, we call this a curbside consult or a second opinion, and that is available to your organization at no cost to you. RAP has a call center that's available Monday through Friday from 7 a.m. until 7 p.m. Please reach out to RAP for assistance. The most important aspect of the RAP program is that it is at no cost to you, and it can save you time, let you continue to concentrate on the services that you most want to provide, and very likely the RAP program could decrease illness and the loss of life in the coming months. Thank you. I'm going to go ahead and ask our panel to join us. If you can go ahead and turn on your cameras, and we will proceed with answering your questions. If you can submit them through the chat function. But in the meantime, I'm going to go ahead and warm up our panel with a couple questions that they can field. Let's start with Marlene. Boy, I really appreciate you participating in today's panel, Marlene. Could you tell us about yourself and, in your opinion, how we can get more adult day services back to providing the valuable service that they provide to their community?
Absolutely, Dr. Weig. And I first want to start with thank you for having this presentation for the adult service centers and for being a valuable resource. My name is Marlene Robinson Statler. I'm the Executive Officer for the Division of Senior and Adult Services in Cuyahoga County. Our adult service offer cognitive therapeutic programming specifically to enhance memory. So most of those happen in the community-based settings that include like recreation activities, it could be music therapy, art therapy, and massage therapy. So obviously right now, our centers are asking us, when can we go back, especially and have those type of activities? And we're providing information, as you shared earlier, about some type of phased approach as we start to move into this, because this is a new arena for all of us. And a lot of them are talking about the caregivers needing support. We talked about isolation earlier, and also being something that's really high on their list. For them right now, part of the strategy that we're working with them is education, especially around vaccination. Also education information regarding the CDC guidelines, as you mentioned, the sanitation, the hand washing, and mask wearing or social distancing as necessary. And those would be the ways that I would say for our adult service centers here in Cuyahoga County to reopen.
Great, thank you. And Ken, thank you for joining us this afternoon. Can you introduce yourself? And I was wondering if, in your opinion, kind of what the basics are for all adult day services, what they should be thinking about in this new phase of the pandemic.
Thank you, and it's good to be with everything today. I'm Ken Wilson. I'm with the Area Agency on Aging in Southwestern Ohio. And for the last year and a half, I've been on the MAC steering committee working with Dr. Lofgren and the Health Collaborative responding to the COVID pandemic. And I've also been co-chairing the Congregate Care Steering Committee protecting seniors in our regions, which has been a very collaborative effort focused on protecting older adults from the pandemic, and then most recently rolling out the vaccines. And as discussed, all the protocols that are in place, that are going into place now, are based on the vaccination status. And that poses some challenges because we don't always know who's been vaccinated or not. And I think one of the themes that we all need to be thinking about is that one size does not fit all. And vaccination rates vary by county, and also between zip codes within your community. And it's really important to understand the vaccination status of your own staff and of the residents that are coming to the adult day center. Just by way of an example, in our region, the county with the highest vaccination rates still has some zip codes that are a quarter of the overall vaccination rate of the county. So there's still areas within the county that are at very high risk. And what's interesting to me is that when we look at the data of the people going into the hospital or testing positive, those counties are overrepresented in the positivity rates for COVID-19 and overrepresented in the people who are going to the hospital. So it's really important for adult day centers to know the status of your facility, of the participants, and of your staff, and also of your community that you're located in, because that's going to vary greatly across the state. And to stay educated and updated about the evolving and changing CDC guidance.
Thank you, Ken, and thanks for doing all the things that you've done down in southwestern Ohio. Sally, you know, after introducing yourself, I know when we spoke last week, you indicated that you had a special interest in Alzheimer's disease and dementia care. And so I think it's appropriate that you're with us this afternoon on the summer solstice, which is the longest day, which is the day of education for the challenges of dementia care. And so many of the adult day services really focus and help participants and families who are dealing with dementia. What are your observations of the particular challenges in dementia care in the adult day settings in this pandemic?
Thanks, Dr. Wiegand. It's a pleasure to be here with everyone today. My name is Sally Bolin, and I'm the Executive Director of an aging service provider, community-based aging services provider in the Toledo, Ohio area called Memory Lane Care Services. And by far our largest service that we offer is adult day. And we actually have everyone who attends our center has some type of memory loss disorder or cognitive impairment. And a large majority of them do have progressive memory loss disorder, whether that be Alzheimer's disease, Parkinson's disease, Lewy bodies, etc. And some of the things that we've noticed since we reopened our center in December that I think centers may struggle with as they look to reopen include things such as testing. You know, certainly I think there's always a little bit of anxiety when you have to have any kind of test, and certainly probably the first time you have to have a swab for testing, people are nervous. Our caregivers have been nervous, so we have been able to explain how we conduct the testing. And certainly, you know, our participants have been nervous too. Some have been able to articulate it, some of them not so much. But I think, you know, that's certainly something you may want to think about is how you'll handle testing. Some things that we've done is we use a consistent staff member every single time. So she's the same person doing the testing for the individual. So she becomes familiar with them, as well as the individual becomes familiar with receiving the test from her too. And she kind of gets to know the person and can have some little tips depending on the person about how quickly they do the test and how they will react to it too. Some of them take a little bit longer than others, but I think that's just part of what you do when you provide dementia care, good dementia care. And you know, I'm sure I'm speaking to the choir here, but you know, when you've met one person with dementia, you've met one person with dementia, and each person is unique and different, and we need to care for them accordingly. Some other areas that we've encountered too is around wearing face masks. You know, certainly that is a requirement that we have here at the center. All of our staff and all of our participants do wear face masks, except when people are eating. But just similar to oftentimes when individuals have canes or walkers, maybe they carry a purse and they may forget about it. So the staff are constantly redirecting and reminding individuals to pull their face mask back up if they happen to droop down. And certainly one of the things that we did prior to opening is we had some discussion with our staff about that and talked about, okay, how are we going to manage this and how are we going to handle it if individuals don't want to wear face masks. And we talked about a lot of the strategies the staff already do when we're encountering other issues like what time am I getting picked up today, or what are we having for lunch today? And the redirection and reassuring and reminding has been pretty effective in us being able to encourage people to wear face masks. And I certainly think because the staff are wearing them too, that whole power of suggestion is helpful too for our participants. A couple other things too, cleaning and disinfection. I know we talked a lot about that in sanitation. We spent a lot of time prior to opening with our staff. We watched some CDC videos about cleaning, sanitation, disinfecting, and then really we have a checklist that the staff have followed. And now I think it's just kind of in their head. At first it was on paper, but now that we've been doing it for 6 months, and we regularly clean and disinfect, not only at the beginning of the day or the end of the day, but throughout the day as well too. And then one of the areas too related to with COVID and with us opening is social distancing. That is a little bit of a challenge with people with dementia. And so we've done a lot of environmental modifications too, rearranged furniture, removed furniture in our center to really help promote those social distancing in our center to follow the recommended practices of the CDC. So thank you so much.
Well, thank you for your kind of area of expertise and helping us with that. And Dr. Coleman, finally, I appreciate you joining us and lending your expertise to this afternoon's discussion. And I also want to just candidly thank you for being my go-to person for the WRAP program in establishing a path for adult day services to be able to get testing done. And so I know Sally just mentioned some of the reasoning about testing. Can you talk to us about what the advantages or challenges might be as the different services that are listening today consider how they may integrate testing into their program?
Absolutely. And before I go into that, I just want to thank everyone for allowing me to be on the call, and thank you for all the work you've done through the pandemic. It's an honor to speak to all of the participants on the call today. I'm excited to help you all in any way that we can offer to get your services up and running, because they are so essential to our communities. Testing in general has gone through many evolutions over the past year and a half. We started out in a state where to get a COVID test was like finding the golden ticket. And we've evolved to a point where nursing homes and assisted livings, and now a few adult day and senior centers, have boxes of testing sitting in their offices and in their closets. And I've heard some people have them stuffed in their trunk because there's just nowhere to put all of these boxes of testing. Now that we have the ability to do these rapid point of care tests, what do we do with them? How do we test? Who do we test? When do we test them? And there are algorithms, there are speeches we could give, and we could go down all those rabbit holes. But let me start just by saying that the point of care tests are going to play a really important role as we reopen and do it in that stepwise, safe manner. The nice thing about these tests is that if you think about a pregnancy test, you get an answer within a few minutes. Just like that, this little cartridge gives you a little sign within 15 minutes and you have a test. If we do these tests on folks who are symptomatic, on folks who are unvaccinated, on folks who are new or just starting, they're a really great way to identify asymptomatic positive cases. In addition to, like I said, having them on hand for those symptomatic cases as well. The beauty of them is they're easy, you get a fast result. Let me add to that too, that when you're deciding how to use them and who to use them on, that's where that WRAP program can really come into play. That's where Dr. Wiegand and myself have been reaching out, doing sort of this test program up in the Northeast Ohio program area to get these tests out there. So my recommendation for you at this time is to get the test by reaching out to that number that's there in the chat. And then the next step is they'll contact one of us so that we can reach out and start to talk about how do we use them. Again, really to focus on they're so easy to use. And secondarily, let's talk about who, why, where, and when to use them.
Great. Thanks, Dr. Coleman. So, Director, do you want to go ahead and review any questions that we have, and we'll start fielding them?
Absolutely. So I do want to encourage all participants to please use this last 30 minutes to your benefit. We're here today to answer questions you might have so that you will feel prepared as you open or you expand your opening in your operation. So please feel free to type those questions in the question box, and I'll be certain that they are read. So there is the one question, and it has to do with rapid testing provided or paid for through the state. So the question is it paid for through the state? I'll start off and then I'll pass it on to Dr. Wigan so he could share information on how this works. Right now, as earlier stated, we are picking up the cost of both the PCR test and the rapid antigen test, depending upon what the need is. And that's something that we would certainly rely upon our medical directors or our RAP team to help us make that determination. But if you utilize our state-supported testing program, there is no cost to you for the program. I don't know if there's anything you want to add to that, Dr. Wigan, or anyone else on the panel.
Yeah, I think there's a little bit of confusion between what a PCR test and what a rapid antigen test is. And I think Dr. Coleman talked about the rapid antigen test. The PCR test is really much more accurate, I guess, from the standpoint that it can tell you, even if you had an infection 10 days ago. The rapid antigen test really has a very narrow window when it's going to come back positive. So if it comes back positive, we're pretty certain that that person has it, and they could be infective depending on whether or not they're vaccinated or not. The PCR test, unfortunately, at least the ones that are available through most settings, require a lab that you send the swab out to a lab, and it may take 2 or 3 days to get the results, which quite honestly doesn't really help you today when you're testing. And so, what I would really consider is thinking about how the rapid antigen test, because really what you want to know is what can we do today, and who can participate today from a staff standpoint or from a participant standpoint. So I think that would be the only thing I would add. And I guess the other thing that I would say is we have another resource that I just think is under-recognized. The RAP program has consulted with some infection preventionists. Those are specialist nurses in most cases who are very skilled and really understand the way that COVID works in and around different settings. And as you're thinking about, what it is that you're doing in your adult day, and some of the challenges in your specific setting, this resource is just invaluable to be able to really focus on your specific setting and what it is that you're thinking about wanting to do, including testing. And in conjunction with the regional medical directors like Dr. Coleman, and some of the other resources that the RAP program has, really can help hopefully decrease your levels of anxiety as you're thinking about what it is that you need to do to really get back to as close to normalcy as you can.
Dr. White, Marlene, I was going to add one more thing. When you talked about the rapid test here in Northeast Ohio, we found that our adult day service centers that have connected with your RAP program, some of their rationale, and this may help some of the other centers as they're thinking about it, some of their rationale has been the fall will be coming and possibly someone is presenting flu-like symptoms. And this way, this is a place someone can have the test done. Also, they said that they know the seniors trust this particular entity that they're going to for adult day services. They'd also trust this particular entity to provide the test for them. So it's been very helpful to connect you with the RAP program, with our senior centers and with our adult day service centers, because they feel that connection, along with, I'm sure Dr. Coleman provided some examples in previous meetings we've had and actually shown how easy it is to perform one of the tests, one of the antigen tests in 15 minutes.
Yeah, we were going to have Dr. Coleman do that today, but we decided not to. She's she's a pro at testing herself.
So I do want to answer this one operational question, and then I want to move on to perhaps another topic. So this is again about testing, and the question is that they've contacted our department and they were told that the rapid antigen tests were not yet available for adult day centers. And right now they were just using PCR. So when we began the state-supported testing program, that is correct, we connected the adult day service centers with our primary lab. I believe many of you were connected with Mako Lab at the time. I believe that's a lab that primarily services adult day. At this time, now with the RAP program, we do believe that we have the personnel and the ability to have the provider that we need. There's also waiver requirements, and I'll let Dr. Wagon talk more specifically about it. But many of the requirements to be able to do the rapid antigen tests, we understood that many would have difficulty being able to satisfy. And so now I believe with RAP, we have more options available to be able to provide rapid antigen in many of these settings. And I think the benefits have already been laid out in part by Dr. Coleman. But Dr. Wagon, do you want to add more clarity to that point, perhaps?
I'm gonna punt this to Dr. Coleman because she's done so much work in getting this set up that I don't want to steal her thunder. But can you kind of talk about that CLIA waiver and how we've kind of gotten around that, Dr. Coleman?
Yeah, absolutely. So one of the big barriers to performing these tests is that you are required to be I'm going to put this in quotes, a lab, meaning that you have a certain waiver called a CLIA waiver. So what the RAP program was able to do is, rather than every adult day center getting their own CLIA waiver and finding a physician to partner with, because the next thing you need is an NPI number or National Provider Identification Number, which as an adult day center, it would be very rare to have. The R3AP program has set up a centralized process to provide you with both the CLIA waiver and the NPI number. So all of the logistic background paperwork that had been a really big barrier to reopening previously is now taken care of through the program. This is really great for you guys because it's going to give you a lot of flexibility to have the test, perform the test, which is not a clinical procedure. And maybe we should have done the testing on this again now that we're thinking about it, but it's very easy. It's what we call an anterior nasal swab. It's a little Q-tip looking thingy, if you will, that goes right just in the front of your nose. Nothing like a brain biopsy like the original PCR test. It doesn't go straight back, just right in the front of your nose. A little bit of a swirl here, a little bit of a swirl there, and then you pop it on there, put a little dropper, what we call it reagent. 15 minutes, you have your result. I'm stressing that 15 minutes because it's so nice to have the result right then and there rather than waiting the 48 hours when you send off your PCR. So the logistics are very easy. Again, the program has kind of taken away all of that paperwork burden and centralized it so that once you're signed up through the state, it's pretty simple to get those test results or those testing supplies to you. I do want to make one comment about sort of the back end work, if you will. Once the test is performed, there is a reporting responsibility when you receive those state testing supplies. Anybody who performs a COVID test does need to report the results and basic demographic information of the person who's being tested. Again, it's very simple. Most places that are doing this have developed a small half half-sheet form, and then that information is uploaded to the state so that they have all of that data of what test results are coming back. So again, it's very simple. There's an app that goes around with it too, where the person doing the testing can do it right on their phone. You don't have to be a medical person to do it. I've had some kits at my house. Like I said, there are so many going around and sort of kind of playing with it to make sure that I know how to do the reagent correctly. My sister, who's non-medical, can do it herself. They sell these kits at Walgreens now. So I just want to say that to underscore the point that they're very user-friendly, and more so every day.
And Dr. Coleman, to add to that point, we do have on our website, there's a video to show you how you can easily and safely swab. So we do have that available as well if you've not had an opportunity to see how it's done. Okay, I'm going to move on to another point here, and this has to do with capacity. There are a few questions asking about, can we open at full capacity? Can you safely operate at a particular capacity? And I guess I want to hear from the panel first about capacity and why that is so important. I think we earlier heard Ken mention that each one is different. Your physical layout is different, what you can and cannot do, and the modifications you can make. So I guess I want to turn it over to the panel, one of the panelists, if you want to address this issue around capacity.
Okay, this is Marlene. In regards to capacity, we're finding that our adult day service centers are reporting that right now, full capacity could look at maybe 35 participants. Right now, they may be providing services to maybe 23. So that means some of the other participants that were using their services for the therapeutic programming, for the cognitive memory programming, are now at home, and they're trying to also make sure that we don't have someone in isolation or someone who, lonely, all those things that would take part. So they're having those concerns that they bring people back, continue the social distancing, along with providing caregiving program, because some of our adult day service programs provide caregiver services for the caregiver, so they have peer-to-peer support. So how they can provide both the full capacity and bringing everyone back while social distancing, along with being able to provide all the programs and services they would normally provide. So those are some of the questions that we are receiving here in Cuyahoga County about that.
And this is Sally. I would agree with what Marlene has said. I think what I've heard from several adult day providers is that they've opened up. They've wanted to make sure that they're maintaining the social distancing and slowly rebuilding census over time to get back to full capacity. I think coordinating the testing and screening and the mask wearing and some of the other things takes a little bit longer. It actually adds more time to your day than prior to COVID. And so thinking through some of that as you reopen, I think is helpful. I know when we opened up in December, we started out pretty small, and we've been slowly over time rebuilding. And we are not at full capacity yet, but each week or two it continues to grow, and then we're also managing, and that's how the testing is so helpful too. Make sure that so that we are not having individuals become infected. So I think capacity can be a little tricky, and as what Ken said, each center is going to be different, but I think there's a lot of factors such as that that you need to look into. And I also think we've had to educate our staff a lot too, and making sure that they have a comfort level and that they feel protected and safe as well. So factoring that in, I think, is very important too. In addition to the family caregivers too, they ask us those types of questions and want to know what we're doing to keep our environment clean and safe and as healthy as possible.
Okay, here's a question. We have only 4 participants who are not vaccinated at our adult day care. Is it okay to do PCR only for someone who has or shows symptoms? I guess as if someone who's symptomatic, is it okay to do PCR only?
Yeah, so I'll take a swipe at that one, and then Dr. Coleman, you can correct me. So the PCR tests are, if you have somebody who's symptomatic, first of all, you really have to think about how you're going to manage that. If that's the only way that they're going to be able to continue to be serviced, if you will, that's where that isolation room can be really really a lifesaver. A PCR test, where it would be reliable, won't tell you anything for 48 hours to 72 hours. And so you're going to probably need to think about, if you do that and the person ultimately is positive, okay, who are all the people that were exposed to that person over that 24 to 72 hours. And so then what do you do with that? And do you do PCR tests on them or whatever? And that's where I think the effectiveness of the rapid antigen test is just so helpful, because in symptomatic individuals, you can stop with a positive rapid antigen test. That is a confirmatory test. If you're doing, almost like screening of people with a PCR, with a rapid antigen test, and it comes back positive and they're asymptomatic, it's still recommended that you do a PCR test to confirm that test. And that's something that I guess I'll say that the RAP program can help you, with some of that nuance, some of those kind of if this, then that. We don't expect you to know that. We've been doing this now for 15 months, feels like 15 years, but 15 months. And so I think that's the way you would have to address symptomatic individuals. I don't know, Dr. Coleman, if you have anything that you would want to add.
No, I think just to underscore the point of the ease of the point of care testing is that the person's symptomatic, you test them, they're positive. That's sort of a one and done. They're definitely positive. It's nice to have, so if you have somebody who's symptomatic and say they were not great at mask wearing, someone who required frequent redirection, then you might test the rest of your participants because of spread, and then you quickly would have your results from that testing as well. If you have an asymptomatic person who tests positive, like Dr. Wiegand mentioned, that does require a PCR to confirm that positive. But the question that I've been asked before is, well, then do we need to have capability to do both? No, in that case, you would isolate that person until they could be taken home from your facility, and they could get that confirmatory PCR at their doctor's office, at CVS, at Walgreens, or where have you. So you wouldn't need to offer the whole buffet of testing options, but it would be important to have at least one, so that in that scenario you can get the ball rolling.
Okay. This one says, if we have only vaccinated staff and clients, so if everyone's vaccinated, do we have to do testing in-house?
First of all, congratulations. That's awesome. You should get a gold star. And that being said, a vaccination is not 100%. And we know that in the general population, young people, like everybody on this panel, still has a perhaps a 5% possibility of the vaccine not providing total immunity, and they can catch COVID even though they've been fully vaccinated. In the population that we care for, it might be something more like 80 or 85% effective. And so even if individuals have been fully vaccinated, there still is the possibility that you need to think about, well, what happens if, as was mentioned earlier, it's October now and somebody starts feeling a little punky, or feels like they've got a temperature, you document that they have a temperature. Well, okay, what do we do with that? It could be the flu. It could be just a common cold, or it could be COVID. And so I think what the testing provides, even in 100% vaccination of staff and participants, is the ability to decipher somebody who might be symptomatic. Because once again, if it's somebody who's symptomatic and you do a rapid antigen test and it's negative, then that's really reassuring that it's not COVID. It might be, the common cold, but that might help you feel a little bit better. Not that the common cold can't run through an adult daycare and, you still have to do all the things like, use your hand sanitizer and the like. So anyway, any other comments from any of the other panelists about that? I guess I got that one.
So the question is, can the department offer adult day service providers more financial operational support during this period when limited attendance and extra costs make break-even financing near impossible? So a few words about that. One, throughout the pandemic, we have been acutely aware of the impact, the business impact for adult day service providers. We've been very intentional by calling out and having funding dedicated specific to provider relief for adult day services. I think the slide earlier pointed out that we've had 2 runs at this, both last year and then this year, to try to push out dollars for adult day service providers. And in fact, it actually turns out to be the 3rd run at it, many of whom were Medicaid providers. We did so in the summer as well, last summer. What is encouraging, if you look at the American Rescue Plan Act, there's a lot of emphasis on the home and community-based services infrastructure, and there's also a lot of emphasis on workforce. And so we do know that within our state and across the country, there are 2 opportunities that I believe we are examining, as well as our other states across the country. One is perhaps enhance FMAP, and is there opportunity in the Medicaid space, as well as dollars from the Older Americans Act. And so we have both dollars from under the umbrella of Health and Human Services, but specific to CMS, our Centers for Medicare and Medicaid Services, and our Administration for Community Living. So the point is, as dollars come in, as we're able to examine where those dollars can go, please note that we are aware of the needs within the home and community-based services space, and adult day services is absolutely one of those critical spaces that we're also looking at. So let me see if we have any other questions. Looks like we have about 5-6 more minutes we can take of questions. I want to make sure I have not missed any questions here. If you have any, I would certainly encourage you, sort of last call here, to get some of these questions in. I think we've covered many in testing. We've covered, there is a question here around shields. I do want to ask that. Dr. Wigan, if you or anyone on the panel can address the value or the usage of shields. This is in particular with transportation. And I know that there's guidance very specific to transportation, so I'd ask you to check our website if you want to know the updated transportation guidance. We'll continue to evolve the guidance and the information that's available. But is there anything specific that you or Dr. Coleman can talk to about shields?
Jessica, you want to field that, and I'll try to provide some color commentary if necessary.
So CDC, in addition to the state website, has good information about transportation in regards to what PPE you should wear, and breaking people down into pods per se. So I think if I'm interpreting the question correctly, face shields for eye protection of the wearer from COVID-19. I don't, if everybody is masked per se, and you don't have anybody who's symptomatic, and you're kind of cohorting your folks, meaning you're doing that potting of people, both for transportation and for activities, the shield should not be as necessary, given that the transmission in your general community is low, and that you're not having any symptomatic folks within your center or certainly on the transportation vehicle. What else to add to that, John?
Yeah, I agree. And, I think, obviously wearing a mask and a shield provides you the optimum, protection to that. But I think the risk in the circumstances that we just kind of described is extremely low. Being able to get it in through your, your eyes if you're wearing a mask and everything. So I would agree with what you mentioned.
Senator, are there any closing comments from any of the panelists for the next few minutes?
One thing I'd like to mention is that it's really important to update the Area Agency on Aging as your adult day centers open up, so that we can help with providing communication out to the community about the status of the adult day centers, educating seniors and caregivers, and also case managers. In our case, the communication has been really good and very helpful. But that'll help in getting people to return back to the adult day center as you're staffing up and as you're able to open and expand your hours and days of operation. So I would encourage strong communication locally.
Can I piggyback on that with the adult day service centers, the communication lines? Also, if you have any questions related to the testing, the PCR, the antigen, reach out to RAP, because they're very helpful and very instrumental, because we receive questions. I filled in the Dr. Weig and Dr. Coleman, Ashley at the state, Director McElroy, and everyone's very receptive and responds with the information for us. So it's just very helpful, because anything that you're thinking about as far as reopening, if it's social distancing, if it's masking, even like the question with the shields, feel free to field those to the SMEs, subject matter experts, as I will say, at the state, that can help you through and guide. And any question you have, they're there to assist. They even mentioned having someone there to assist with the prevention and things like that.
So I guess this, Sally, go ahead, sorry, yeah.
The only other thing that I maybe would just mention, as centers look to reopen is know that, sometimes opening slow and experimenting is helpful. How we started doing things when we first opened up is not how we're doing things anymore. And so, you have peers around the state. So I encourage you to call. Every time I talk to another provider, I learn something new, and I'm very grateful for those opportunities, so that we can continue to grow and do the best that we can for the people that we serve. Director McElroy, I appreciate your openness to continue to support our industry. We've been hit really, really hard, as you are well aware, because of this pandemic. And I think that we're all slowly reopening, but it's going to take time, just like it is many other service industries and many other parts of the community. And so us working together and collaborating, and people have been wonderful. I've found at the state level and our local community level and with our area agencies. And so communicating, I think, is really, really important. So thanks.
Well, thank you, Sally. And just to, I guess, to wrap up here, as Sally mentioned, we want to be helpful. If you have a need, again, with the testing, we want to be able to provide that. If you need help with vaccines, if you need help with PPE, we have that available as well. And then finally, having that consultation, that piece with your infection prevention and control is going to be so critical. So please feel free to reach out to RAP. Again, that number is 1-855-732-7632. Again, 1-855-732-7632. Thank you so very much for all that you've done and all that you will continue to do. We stand ready to support you. And good luck, everyone.